Hello and welcome to Health Zone, where your wellness journey begins with trusted information and practical steps to live a healthier life. Today, I want to talk about something that far too many people ignore until it becomes a serious issue: your kidney health. You may not feel anything wrong at first. You may think everything is fine. But the reality is, if you're doing certain things every single day, you're not giving your kidneys the chance to heal, recover, or function properly. The kidneys are two of the most vital organs in your body. Every minute, they filter nearly half a cup of blood, removing toxins, balancing fluids, and supporting blood pressure regulation. But despite their importance, they're often the most neglected, and many daily habits, ones that seem harmless, can quietly and steadily harm your kidney health. So today, we're going to focus on these daily mistakes and how they interfere with your body's natural healing process. Let's start with something that's on almost every dining table: salt. Most people consume far more sodium than the body needs. It's hidden in processed foods, sauces, canned goods, takeout meals, and even so-called healthy snacks. High sodium intake forces the kidneys to work harder to filter out excess, and over time, this burden can cause damage. The more salt in your bloodstream, the more water your body retains, increasing blood pressure, a major risk factor for kidney disease. If you're consuming salty foods every day and not making a conscious effort to reduce sodium, your kidneys are under constant stress, and healing becomes nearly impossible. Another silent contributor is dehydration. You've probably heard that staying hydrated is important, but do you really understand what it means for your kidneys? Your kidneys rely on adequate fluid to filter waste from the blood and flush it out through urine. When you don't drink enough water, waste can accumulate and the kidneys can't function efficiently. Chronic dehydration also increases the risk of developing kidney stones, painful, damaging obstructions that can harm the kidneys even further. If you're going through the day with only 1 or 2 glasses of water, you're not just thirsty. You're also limiting your kidneys' ability to do their job and regenerate. Next, let's talk about something that millions of people use without a second thought: over the counter painkillers. While medications like ibuprofen and naproxen can be helpful for occasional aches and inflammation, frequent or long-term use can harm your kidneys. These drugs reduce blood flow to the kidneys, and when taken daily may cause lasting damage, especially in people with pre-existing health conditions. Many don't realize this because the effects aren't immediate. They build quietly over time. If you're someone who regularly takes these medications for chronic pain, it's essential to speak with a healthcare provider about safer alternatives and get regular kidney function tests. Now we have to address the food choices we make every day, particularly processed foods. Items like packaged snacks, frozen dinners, fast food, and instant meals are typically high in sodium, unhealthy fats, artificial additives, and phosphorus-based preservatives. While they may taste good and save time, they do little to support your kidneys. In fact, they often do the opposite. A diet heavy in processed foods contributes to inflammation, poor blood pressure control, and toxin buildup, all of which interfere with kidney repair. Healing your kidneys is not just about what you avoid. It's also about what you choose to nourish your body with. Fresh vegetables, whole grains, fruits, and lean proteins provide the nutrients your kidneys need to function well and repair damage. Let's also take a moment to talk about sleep, something many people treat as optional. Your body heals during rest, and that includes your kidneys. When you don't get enough sleep, your blood pressure tends to rise and your hormones become imbalanced. These 2 factors alone are enough to impair kidney function. People who consistently get fewer than 6 hours of sleep per night are at a higher risk of developing kidney problems. The healing process is significantly slowed when you don't allow your body the rest it needs. If your sleep is irregular or interrupted daily, you are unknowingly keeping your kidneys in a state of stress and dysfunction. Finally, perhaps the most damaging habit of all is ignoring chronic medical conditions like high blood pressure and diabetes. These are leading causes of kidney disease worldwide. If these conditions are not properly managed, they can slowly and silently destroy the nephrons. the filtering units inside the kidneys. What makes this even more dangerous is that kidney damage from these diseases often shows no symptoms until it's already advanced. If you're living with hypertension or diabetes and not monitoring your levels, not taking prescribed medications, or not following up with your doctor, you're allowing these conditions to chip away at your kidney health every single day. Healing isn't possible when the root cause of the damage continues unchecked. So, what's the bottom line? Your kidneys have an incredible ability to support your health, detoxify your body, and keep your internal systems in balance. But they are not invincible. If you're doing these harmful things daily, eating too much salt, staying dehydrated, overusing painkillers, consuming processed foods, skipping sleep, or ignoring chronic conditions, you are preventing your kidneys from healing and putting yourself at risk for long-term complications. The good news: it's never too late to start making better choices. Swap the processed foods for fresh ones. Replace soda with water. Talk to your doctor about the medications you take. Prioritize your sleep. Manage your chronic conditions proactively. The steps are simple, but the impact is powerful. Thank you for watching. If you found this video valuable, don't forget to like, subscribe, and share it with someone who needs to hear this message today. At Health Zone, we believe that informed choices lead to empowered lives. Until next time, take care of your kidneys. They're working for you every single day, whether you notice or not. One of the most damaging yet overlooked habits when it comes to kidney health is consuming too much sodium on a regular basis. Most people think of salt as a simple seasoning to enhance flavor, but few realize the hidden impact it has on the body, especially on the kidneys. Sodium is an essential mineral. The body needs it to maintain fluid balance, nerve function, and muscle contractions. However, when it's consumed in excess, it becomes a silent threat. Your kidneys are responsible for filtering out excess sodium from the bloodstream. When you consistently eat high-sodium foods, your kidneys are forced to work harder to excrete the surplus, putting them under unnecessary stress day after day. Over time, this added workload can reduce their efficiency and damage the delicate filtering units within them. The trouble is that high sodium intake doesn't always come from the salt shaker. It's hidden in everyday foods, processed snacks, canned goods, packaged meals, deli meats, sauces, condiments, and fast food. Even foods that don't taste particularly salty can contain more sodium than you'd expect. Many people who believe they're eating a normal diet are often far exceeding the recommended daily sodium limit, which is around 300 milligrams for healthy adults, roughly 1 teaspoon of salt. For people with high blood pressure or kidney concerns, that number should be even lower, often below 500 milligrams per day. Yet the average person regularly consumes much more than that, often without realizing it. Excess sodium in the bloodstream draws water into the blood vessels, increasing the volume of blood flowing through them. This leads to higher blood pressure, a major risk factor for kidney disease. High blood pressure damages the tiny blood vessels inside the kidneys, reducing their ability to filter waste and regulate fluid balance. This damage can accumulate over time without symptoms, and by the time it becomes noticeable, kidney function may already be severely compromised. In people who already have early-stage kidney problems, a high-sodium diet can accelerate the decline in function, making it difficult or even impossible for the kidneys to heal or recover. In addition to harming the kidneys directly, high sodium intake also impacts other systems in the body that are closely connected to kidney health. It increases the risk of heart disease, contributes to fluid retention, and can lead to swelling in the hands, feet, and ankles. For individuals with already compromised kidney function, this can result in further complications such as shortness of breath, fatigue, and increased risk of cardiovascular issues. The kidneys and the heart work hand in hand. When one is under strain, the other often suffers as well. Reducing sodium intake doesn't mean your meals have to be bland. It's about making smarter choices, reading food labels, cooking at home using fresh ingredients, and using herbs and spices instead of salt to flavor your meals. It's also about being mindful of hidden sources of sodium in foods that are marketed as healthy, but may still be processed. Small, Consistent changes can significantly reduce the sodium load on your kidneys and give them the opportunity to function more efficiently and heal if needed. Understanding the impact of sodium is not about fear, it's about awareness. By taking control of what goes on your plate, you take control of your kidney health. Making the choice to reduce sodium is one of the most powerful steps you can take toward long-term wellness. Not drinking enough water is one of the most common and underestimated habits that can slowly deteriorate your kidney health over time. The kidneys are vital organs with the critical job of filtering waste products, toxins, and excess substances from your blood and removing them through urine. For this filtration process to happen effectively, your body must be adequately hydrated. Without enough water, your kidneys struggle to maintain the balance of fluids and electrolytes, and the waste buildup in your system begins to increase. When dehydration becomes a regular occurrence, it doesn't just affect how you feel. It puts real, measurable stress on your kidneys and can prevent them from functioning at their best. Many people believe that drinking fluids occasionally throughout the day is enough, but the truth is, mild chronic dehydration is extremely common. Busy schedules, caffeine intake, sugary drinks, and simply not feeling thirsty can all lead people to forget or ignore their need for water. The problem is that thirst is actually a delayed signal. By the time you feel thirsty, your body is already experiencing a degree of dehydration. When you consistently drink less water than your body needs, your urine becomes more concentrated with waste products, which makes it harder for your kidneys to eliminate toxins efficiently. Over time, this can increase the risk of developing kidney stones, urinary tract infections, and even long-term kidney damage in more severe cases. Kidney stones are a direct consequence of insufficient water intake in many cases. When there isn't enough fluid to dilute the minerals and salts in your urine, these substances can clump together and form hard crystals. Passing a kidney stone is not only painful, it can also cause inflammation, infection, and trauma to the urinary tract and kidneys. Staying properly hydrated helps keep the urine diluted, making it less likely for these stones to form in the first place. But the consequences of dehydration go beyond kidney stones. In severe or prolonged cases, chronic dehydration can lead to acute kidney injury, a condition where the kidneys suddenly stop working properly, which can be dangerous if not treated quickly. Another factor to consider is how dehydration affects blood pressure and circulation. Proper hydration helps maintain healthy blood volume and ensures that enough blood reaches the kidneys for effective filtration. When you are dehydrated, blood flow to the kidneys may decrease, making it harder for them to do their job. In people with pre-existing health conditions like diabetes or high blood pressure, both of which already strain kidney function, low water intake can compound the damage. Your kidneys are always working, filtering your blood 24/7, and they need enough fluid to flush out waste and maintain balance. When that fluid isn't there, their efficiency decreases and the risk of complications rises. What many people don't realize is that simply improving hydration can make a significant difference in how your kidneys perform. Drinking enough water each day helps the kidneys maintain proper filtration, reduces the risk of infections, and supports overall detoxification. While the exact amount of water needed varies by individual, activity level, and climate, a general rule is to aim for around 8 to 10 cups of water per day. For those who sweat more or live in hotter environments, that number may need to be higher. It's also important to remember that not all beverages hydrate equally. Sugary drinks, sodas, and caffeinated beverages like coffee and energy drinks can contribute to dehydration, especially when consumed in excess. Choosing water as your primary beverage and spreading your intake evenly throughout the day can help keep your kidneys working efficiently. Developing a consistent habit of drinking water, not just when you're thirsty, supports your body in countless ways. Clear, pale yellow urine is a good sign that you're well hydrated, while dark yellow or amber colored urine often signals dehydration. Simply becoming more aware of your fluid intake and making hydration a daily priority can reduce strain on your kidneys and support your long-term health. Ultimately, not drinking enough water may seem like a minor habit, but its impact on your kidney health is significant. Proper hydration is one of the simplest and most effective ways to protect your kidneys, prevent disease, and help your body function the way it's meant to. It's a small, daily choice that creates a powerful ripple effect throughout your entire system. By giving your kidneys the water they need, you're giving your body a better chance at health, balance, and resilience. Using over-the-counter painkillers frequently may seem harmless, especially when you're dealing with common issues like headaches, back pain, or muscle soreness. But what many people don't realize is that the long-term or frequent use of medications such as NSAIDs, non-steroidal anti-inflammatory drugs, can quietly harm your kidneys. These include common drugs like ibuprofen, naproxen, and others found in many households. When used occasionally and correctly, these medications can be effective for managing pain and inflammation. However, when taken too often or in higher than recommended doses, they can begin to interfere with kidney function in ways that most users are unaware of. Your kidneys rely on healthy blood flow to function properly. NSAIDs work by blocking enzymes called COX-1 and COX-2, which are involved in the production of prostaglandins. While prostaglandins are part of the pain and inflammation pathway, they also help maintain blood flow to the kidneys. When NSAIDs block these enzymes, they reduce the production of prostaglandins, which in turn reduces blood flow to the kidneys. For someone with healthy kidneys, occasional use of NSAIDs may not cause immediate issues. But for those who take them regularly, daily or multiple times a week, this reduction in blood flow can begin to strain the kidneys, making it harder for them to filter waste and maintain fluid balance. This risk increases significantly for people who already have underlying conditions like high blood pressure, diabetes, or existing kidney disease. Even people who don't yet show symptoms may have reduced kidney reserve, and adding regular NSAID used to the mix can speed up the loss of function over time. What's especially dangerous is that kidney damage from NSAIDs is often silent. You may not feel anything at first, no pain, no obvious symptoms, until a blood test reveals that your kidney function has already declined. In severe cases, frequent NSAID use can even lead to acute kidney injury, a sudden and serious drop in kidney function that may require hospitalization and medical intervention. It's not just about how often you take painkillers, but also how long you take them. People who use NSAIDs for chronic conditions like arthritis or persistent back pain may rely on them daily without realizing the long-term impact. They may not be aware of the potential for cumulative damage. Some even take more than the recommended dose, thinking that more medication means more relief. But this can increase toxicity and further stress the kidneys. NSAIDs can also interact with other medications, including blood pressure drugs and diuretics, in ways that amplify their harmful effects on the kidneys. This makes it especially important for people who are on multiple medications to speak with a healthcare provider before using these drugs regularly. Another concern is that these medications are so easy to access. You don't need a prescription for many NSAIDs, and they're heavily marketed as safe, everyday pain solutions. But just because something is available over the counter doesn't mean it's free from risks. NSAID-induced kidney damage is well documented in medical literature, and yet the public awareness remains relatively low. There's a misconception that these drugs are completely safe as long as they're available without a prescription, but this simply isn't true when it comes to long-term use or high-frequency use. It's important to understand that managing pain doesn't have to come at the cost of kidney health. There are alternatives, especially for people who need pain relief on a regular basis. Non-NSAID medications, physical therapy, stretching, acupuncture, anti-inflammatory diets, and even stress reduction techniques like mindfulness and gentle movement can help manage chronic pain without putting undue stress on your kidneys. In cases where medication is necessary, using the lowest effective dose for the shortest duration under medical supervision is the safest strategy. And most importantly, if you find yourself reaching for painkillers day after day, it's a sign that you should consult a healthcare professional to understand the root cause of the pain rather than just masking it. Pain is the body's way of signaling that something needs attention. Suppressing it without investigating the underlying issue may provide short-term comfort, but can lead to long-term harm. Your kidneys are responsible for filtering nearly 50 gallons of blood every single day. They deserve to be protected, not overburdened. By being mindful of how and when you use NSAIDs, you're not only preserving kidney health, but also giving your body a better chance to heal, adapt, and recover naturally. Being informed is the first step toward making safer choices that benefit your overall health. Eating excess processed foods has become a common part of modern life, but what many people don't realize is how significantly this habit can impact kidney health over time. Processed foods are convenient, affordable, and widely available, often marketed as quick solutions for busy lifestyles. But behind the packaging and appealing taste are ingredients that can gradually wear down the body's natural systems, especially the kidneys. These foods are typically loaded with added sodium, unhealthy fats, refined sugars, artificial preservatives, and phosphorus-based additives, all of which can contribute to kidney stress when consumed regularly. The kidneys are responsible for filtering waste, balancing electrolytes, and regulating fluids. When you eat foods high in sodium and phosphate additives, which are commonly found in processed meats, packaged snacks, frozen dinners, canned soups, and fast food, your kidneys are forced to work harder to remove the excess. Over time, this extra workload can lead to inflammation in the kidneys and reduce their ability to function efficiently. For people with existing health conditions like hypertension or diabetes, the risk becomes even greater, as the combined effect of processed food and underlying disease can accelerate kidney damage. One major concern with processed foods is their high sodium content. Even foods that don't taste particularly salty may be loaded with sodium to enhance flavor and shelf life. High sodium levels can lead to elevated blood pressure, which directly harms the delicate blood vessels inside the kidneys. When these vessels are damaged, the kidney's ability to filter blood declines. In people who already have early stages of kidney disease, a diet high in sodium can significantly worsen their condition and make healing more difficult. Another hidden danger in processed foods is the presence of phosphorus additives. While phosphorus is a mineral the body needs, excess amounts, especially from inorganic sources used in processed food, can become harmful. These additives are often included to enhance texture, prolong shelf life, or act as preservatives, but they are absorbed much more readily by the body compared to naturally occurring phosphorus in whole foods. When phosphorus levels in the blood become too high, it can lead to calcium imbalances, bone weakening, and contribute to vascular calcification, putting additional stress on the kidneys. Unlike natural phosphorus found in beans, nuts, and whole grains, the phosphorus in processed food is not beneficial. It is harmful when taken in excess and often goes unnoticed by the average consumer. Processed foods also tend to be low in essential nutrients like potassium, magnesium, fiber, and antioxidants that support kidney health. A diet lacking in these protective nutrients can lead to poor blood sugar control, oxidative stress, and inflammation, all of which are harmful to kidney function. People who rely heavily on processed foods may feel full, but their bodies are actually being deprived of the nutrients they need to repair and protect vital organs like the kidneys. Moreover, the high glycemic index of many processed carbs can lead to insulin resistance and type 2 diabetes, which are leading causes of chronic kidney disease worldwide. One of the most troubling aspects of processed foods is how they affect long-term dietary patterns. Because they're engineered to be hyper-palatable, meaning they stimulate cravings and reward centers in the brain, they can create a cycle of dependence where healthier, whole foods are gradually pushed out of the diet. This not only increases the intake of harmful ingredients, but also decreases the intake of protective nutrients, making it harder for the kidneys to recover from everyday stressors. Healing the kidneys isn't just about avoiding harmful substances. It's also about giving the body what it needs to repair, and processed foods typically fall short on both fronts. Making the shift away from processed foods doesn't have to be overwhelming. It starts with small steps: reading food labels, cooking more meals at home, choosing fresh fruits and vegetables, and opting for whole grains and lean proteins. By making these changes, you reduce the intake of excessive sodium, phosphorus, and harmful additives while increasing the nutrients your kidneys need to thrive. You may also find that your energy improves, your digestion stabilizes, and other health issues begin to ease as a result. Your kidneys work hard for you every single day, and by choosing whole, nutrient-rich foods, you're helping them do their job more effectively and giving them the support they need to stay strong for the long haul. In the end, while processed foods may offer short-term convenience, their long-term impact on kidney health can be significant. Being mindful of what you eat and gradually reducing your intake of highly processed items is one of the most effective ways to protect your kidneys and promote overall well-being. It's not about perfection. It's about progress and making more informed choices that benefit your health today and in the years to come. Lack of sleep is often overlooked when it comes to kidney health, but it plays a much bigger role than most people realize. Sleep is not just a time for rest. It's a vital period when the body undergoes repair, restoration, and detoxification. During deep sleep, the body's systems slow down, allowing essential organs, including the kidneys, to reset and function more efficiently. When you consistently don't get enough sleep, your kidneys don't get the downtime they need, and over time, this can lead to real physiological damage. People often think of sleep as a luxury, but it is actually a necessity, just like food, water, and oxygen, for maintaining long-term kidney function. Your kidneys follow a natural circadian rhythm, just like your brain and other organs. They work in cycles, filtering blood, balancing electrolytes, and managing fluid levels in sync with your sleep-wake patterns. When those patterns are disrupted by insufficient or poor quality sleep, the kidneys struggle to maintain their regular rhythm. Studies have shown that individuals who sleep fewer than 6 hours a night are more likely to develop chronic kidney disease than those who get 7 to 8 hours consistently. This is not just about being tired. It's a sign that sleep deprivation affects the hormonal and nervous systems in ways that directly stress the kidneys. One major impact of poor sleep is on blood pressure regulation. During restful sleep, blood pressure naturally dips, which gives blood vessels and organs a break from the constant pressure of circulation. When sleep is inadequate, this nightly dip in blood pressure may not occur, leading to what's known as non-dipping blood pressure. This sustained pressure puts extra strain on the tiny blood vessels in the kidneys, potentially damaging the glomeruli, the filtering units within the kidneys. Over time, this can reduce the kidney's ability to effectively filter toxins and maintain electrolyte balance. High blood pressure is already a leading cause of kidney disease, and lack of sleep only amplifies the risk. Lack of sleep also affects how the body processes insulin and glucose, contributing to poor blood sugar control. This is especially concerning because diabetes is one of the most common causes of kidney failure. When sleep is consistently cut short, insulin sensitivity decreases, and the risk of developing type 2 diabetes increases. Once again, this adds pressure to the kidneys, which are already working hard to regulate blood chemistry and remove waste products from the bloodstream. Without proper rest, the body loses its ability to balance these systems effectively, making it harder for the kidneys to do their job and increasing the chances of long-term damage. Another hidden consequence of sleep deprivation is the increase in systemic inflammation. Inadequate sleep raises levels of inflammatory markers in the blood, which can damage blood vessels and tissues throughout the body, including those in the kidneys. Chronic low-grade inflammation has been linked to numerous health issues, including cardiovascular disease, autoimmune conditions, and chronic kidney disease. By consistently depriving the body of sleep, you allow this inflammation to linger and potentially cause harm to the kidneys over time. Furthermore, sleep-deprived individuals are more likely to experience oxidative stress, which contributes to cellular damage throughout the body. The behavioral side effects of sleep deprivation also cannot be ignored. When you're tired, you're more likely to make poor dietary choices, skip exercise, rely on caffeine or sugar for energy, and feel too fatigued to prioritize hydration or medication schedules. All of these factors can indirectly contribute to kidney strain. Over time, what seems like a simple lack of sleep becomes a pattern of behavior that undermines your overall health. and places cumulative stress on your kidneys. Improving sleep doesn't just benefit your energy and focus, it supports your entire body at a cellular level. Simple habits like maintaining a consistent sleep schedule, reducing screen time before bed, avoiding heavy meals and stimulants in the evening, and creating a relaxing bedtime routine can significantly improve sleep quality. Even small changes can help your body transition into deeper, more restorative sleep, allowing your kidneys to rest and recover. For individuals with existing kidney concerns, making sleep a priority is not optional. It's essential. In today's fast-paced world, sacrificing sleep may seem like the norm, but it comes at a cost. Your kidneys are silently working around the clock to keep your body balanced and clean. Giving them the rest they need through consistent, quality sleep is one of the most powerful ways to support their function and protect your long-term health. Sleep is not just about feeling rested. It's about giving your body, especially your kidneys, the chance to heal, reset, and thrive. Ignoring medical conditions, especially those that are known to impact the kidneys, can be one of the most dangerous habits when it comes to long-term health. The kidneys are remarkably resilient organs, but they are also sensitive to the effects of uncontrolled health issues such as high blood pressure, diabetes, infections, and autoimmune disorders. When these conditions are left unmanaged, either due to a lack of awareness or neglect, they begin to silently damage the kidneys over time. Many people don't experience noticeable symptoms in the early stages of kidney deterioration, which makes it even easier for damage to progress unnoticed until it's too late. One of the most common conditions that affects kidney health is hypertension, or high blood pressure. It puts constant pressure on the delicate blood vessels within the kidneys, causing them to weaken, narrow, or harden. Over time, this damage reduces the kidney's ability to filter blood properly. Unfortunately, high blood pressure is often referred to as a silent killer because it can exist for years without obvious symptoms. If someone ignores the need for regular checkups or dismisses mild symptoms like headaches or fatigue, they may miss the opportunity to detect and manage high blood pressure before it harms their kidneys. Diabetes is another leading cause of chronic kidney disease, and it requires diligent monitoring to prevent complications. When blood sugar levels remain elevated for long periods, they damage the tiny filtering units in the kidneys, impairing their ability to remove waste and excess fluids. Uncontrolled diabetes doesn't just affect blood sugar. It has a cascading effect on multiple organs, with the kidneys being among the most vulnerable. Many people may not understand the seriousness of managing blood sugar until they begin to see signs of kidney strain, such as swelling in the legs or changes in urination. By then, significant damage may already be done. Infections, particularly urinary tract infections that are left untreated, can also ascend to the kidneys and cause lasting harm. When bacteria reach the kidneys, it can lead to a condition called pyelonephritis, which, if not properly treated, may result in scarring or chronic kidney infections. Ignoring symptoms like frequent urination, burning during urination, or lower back pain can allow the infection to progress. Likewise, viral illnesses or autoimmune diseases such as lupus, if not managed with proper care and medication, can inflame or damage kidney tissue. Another issue is the lack of routine medical checkups. Many people wait until symptoms become unbearable before seeking medical help. Unfortunately, with kidney disease, symptoms like fatigue, swelling, or nausea often appear only in the later stages. This delay in diagnosis reduces the chances of slowing down the progression or reversing the damage. Regular health screenings, including blood pressure, blood sugar, and kidney function tests, are simple but powerful tools that can catch problems early, when they're still manageable. Additionally, self-medicating or stopping prescribed treatments without consulting a healthcare provider is a common and risky habit. Skipping medications, especially for chronic conditions like hypertension or diabetes, directly increases the risk of kidney damage. There's also a trend where people turn to unverified home remedies or supplements without medical guidance, which can sometimes contain harmful substances that put extra burden on the kidneys. Understanding and acknowledging a medical condition is the first step toward healing and prevention. Ignoring a diagnosis, delaying treatment, or avoiding medical advice doesn't make the problem go away. In fact, it often allows the issue to worsen in silence. The kidneys may not speak loudly, but they give signs when something is wrong. Listening to those signals, getting regular checkups, following treatment plans, and staying informed about your health conditions are essential actions for protecting kidney health. Caring for your kidneys isn't just about avoiding certain foods or drinking more water. It's about taking ownership of your health in a consistent and proactive way. That includes being honest with yourself about any medical conditions you may have and understanding how they interact with your body's vital systems. Early detection, consistent treatment, and open communication with healthcare professionals can make all the difference in preserving your kidney function and overall well-being. Ignoring health problems may feel easier in the short term, but facing them with knowledge and action is what truly supports long-term health. In conclusion, protecting your kidneys is not about making drastic changes overnight. It's about becoming aware of the daily habits that may be silently harming them and choosing better options, step by step. Whether it's cutting back on processed foods, being mindful of painkiller use, getting enough sleep, staying hydrated, or managing underlying health conditions like high blood pressure and diabetes, every small effort counts. Your kidneys are vital to your body's balance and detoxification, and while they work quietly in the background, they deserve attention and care. By understanding the risks and making informed choices, you give yourself the best chance to prevent long-term kidney issues and support overall wellness. Remember, healing starts with awareness, and your daily decisions have the power to make a lasting difference.